Welcome everyone to today's Health Center Preparedness Forum. As we begin today's presentation, we want to extend our thoughts and prayers to all those impacted by the recent hurricanes on the East Coast. We know emergency preparedness is crucial for situations like this, and we hope today's presentation provides useful insight in how to prepare and respond to future emergencies. Next slide. As we begin our presentation, I just want to cover a few housekeeping items. All participants have been placed on mute and are encouraged to use the Q&A or chat for any questions. This webinar is being recorded and materials will be emailed to all participants after today's event. At the end, you will also receive an evaluation, and we do encourage you to please provide us feedback to improve future events. Next slide. This is the first of 4 webinars that we plan to present in this year's upcoming webinar series. Our initial topic will focus on emerging issues, specifically infectious disease, as the theme for today. Next slide. This series is a collaborative effort from these national training and technical assistance partners, who provide free training and technical assistance to support existing and potential health center grantees and lookalikes. NTAPs are funded to offer this training and TA to health centers in a manner that increases patient safety and health outcomes, effective service delivery, especially to special, vulnerable, and underserved rural, frontier, and urban populations. This training and TA often takes place in the form of learning collaboratives, state, regional, national trainings, webinars, newsletters, toolkits, resources, and other amazing information. We hope together to address challenges across these special and vulnerable populations served by our partner health centers and health center lookalikes. Next slide. I have the pleasure of moderating today's session along with my colleague who will introduce himself in a second. My name is Gladys Carrillo, and I am the Director of Program Services with the National Center for Farmworker Health. And I'm accompanied today by Bob. Go ahead, Bob.
Hi, I'm Bob Burns, Director of the National Center for Health and Public Housing. Next slide. Today's agenda is designed to kick off our year, and so we wanted to start with emerging issues and an overview of the effects of climate change and so on all of us and health in general. Today we have 3 great speakers. Dr. Evan Mallon, Dr. Melissa Briggs, and Dr. Bethany Alcauter. Evan will be talking about the human health effects of climate change. Melissa will be talking about respiratory viruses, vaccine preventable diseases, and other emerging threats. And Bethany will be getting into depth on H5N1. And then, of course, we'll be looking and hoping you guys will fill out some evaluations for us and after we do our Q&A session. We're going to start with a Mentimeter question, and initially you can use the QR code for those of you who are familiar and able. So it's up on your screen right now, and in a second we'll put the question up on the screen. Okay, so in the final months of 2024, what's your top concern for your organization's emergency preparedness or response efforts? So what's your top concern? Either an issue around how to do it, or the particular emergency issue that's top with you, whether it's floods or fires or earthquakes or hurricanes. We get a lot of good responses coming in. Cybersecurity and downtime planning. That's a good thing to bring up. Plan execution, always critical. Business continuity. How are you going to keep the health center running while dealing with the issues for your staff and for your patients? Inclement weather response. Great. Lack of electricity, always critical. Okay, hurricane season flooding, which of course we've just seen a lot of over the last couple of weeks. Hopefully Evan can talk about a little bit during his presentation. Natural disaster planning in general. Okay, great. Well, thanks very much for those responses. And now just real quickly, let me introduce our speakers. Our first speaker from CDC, Dr. Evan Mallon, is a health scientist with CDC's Climate and Health Program. Since 2021, he's served on the translation and evaluation team, collaborating with state and local health departments across the U.S. to develop, evaluate, and improve their climate and health activities through the Climate Ready States and Cities Initiative. He primarily focuses on heat-related climate and health activities, including the evaluation of CDC's heat guidance resources. And following Evan from CDC will be Dr. Melissa Briggs-Hagen. Melissa is a medical epidemiologist with the Centers for Disease Control and Prevention and a captain in the U.S. Public Health Service. She is board certified in internal medicine and pediatrics and also has a master's in public health. From 2011 to 21, she worked in CDC's Center for Global Health with a focus on infectious disease, including malaria, TB, and HIV. Since 21, she's worked in the National Center for Immunizations and Respiratory Diseases, where she initially worked full-time on COVID-19. She currently leads a team of scientists focused on respiratory virus research and also recently served as the acting CMO, Chief Medical Officer in the Immunization Services Division. She has published over 50 manuscripts on a wide range of infectious diseases and health equity topics and continues to practice clinically, providing primary care services at the Good Samaritan Health Center Clinic in downtown Atlanta, which is an FQHC. So we're very happy to have Evan and Melissa with us. And at this point, I'm going to turn it over to Dr. Evan Mallon. Evan?
All right, thank you very much, Bob. And thank you everyone for having me. I'm very happy to be telling you a little bit about some of our work here at CDC as we focus on the human health effects of climate change and all the various ways that it will affect human health. Next slide, please. So this infographic, I think, does a really good job of showing both the direct and indirect health effects of climate change and all the different ways that we can expect climate change to affect our health across the United States. Much of today, I'm going to be focusing on heat and hurricanes, but there are quite a range of ways that climate change will affect human health. So next slide, please. And as I progress through this presentation, I want to just remind everyone that climate change does not affect everyone equally. There are various aspects that we need to consider as we think about climate change impacts on human health. Those are the exposure to climate threats, that is, these threats such as hurricanes, extreme heat, any of these kinds of effects that you may see. Very importantly, we also want to be considering sensitivity, that is, the degree to which someone may be affected by this exposure to the climate threat. For example, those with pre-existing conditions such as cardiovascular diseases or asthma may be more heavily impacted than others in the same kind of climate exposure. Finally, the ability to adapt, also known as adaptive capacity, that is the ability for someone to be able to cope with these exposures and their own sensitivity or even modify their local environment to be less impacted by that climate threat. So I want you to keep these in mind as we talk about some of the particularly disproportionately at-risk populations to each of these climate hazards. Next slide, please. So I'm going to focus a bit on extreme heat first because this is one of the most direct health impacts of climate change. Climate change is making heat waves worse. Higher heat, increased humidity, longer and more frequent heat waves can lead to dehydration and stroke. There are many individuals who are more vulnerable to extreme heat, including those who are more regularly exposed to it, that is outdoor workers, athletes, people in cities who are affected by the urban heat island, but also in terms of ability to cope with this heat, we have people without air conditioning, people with chronic diseases, pregnant people, older adults, young children, all of these may be disproportionately at risk. Next slide, please. And one of the reasons why we focus particularly on heat at CDC is that heat waves are increasing in intensity, frequency, and duration. And all of these pose significant threats to public health. In fact, heat events in the US cause an average of 67,000 annual emergency department visits and about 1,200 annual deaths That is direct attribution according to death certificates. However, CDC recognizes this is very likely an underestimate. Recent research has estimated that in the US, the total annual deaths attributable to heat is more around the range of 12,000 every year. So this is one of the direct impacts, but there are also many indirect health effects that make this very difficult to quantify. Next slide, please. And not only can this lead to significant physical health harms, it can lead to mental health harms as well. And one of the things that we are focusing on here at CDC is the interaction with certain medications that can increase heat-related health risks. This is also something that can exacerbate other exposures like worsening air pollution. More on that in just a moment. Next slide, please. Let's talk about that a little bit. It may not seem so obvious at first, but climate change will directly affect air pollution. Climate change will increase the risk of wildfires by producing warmer and drier conditions. There is also an increase in smog, pollen, and mold, which can lead to asthma and allergy attacks. Climate change is projected to harm human health by increasing ground-level ozone and particulate matter air pollution. Ground-level ozone is a key component of smog and is associated with many health problems in diminished lung function, increased emergency room visits for asthma, and increases in premature deaths. Individuals that are more vulnerable to air pollution include those with heart and respiratory conditions such as heart disease, asthma, and chronic lung disease. Next slide, please. Extreme weather encompasses a variety of effects, such as increased frequency and severity of heavy downpours, floods, droughts, and major storms like hurricanes. This can lead to injury, illness, displacement, and death. One of the things that's so difficult about quantifying the effect of this is that there are a wide range of indirect health effects that can stem from any of these kinds of exposures. In fact, a recent paper published this month in Nature estimates that the average tropical storm resulted in an additional 7,000 to 11,000 deaths in the 15 years that followed each tropical storm. This is due to a variety of stressors, such as economic loss, lack of or disruption in healthcare access, mold, water contamination, physical and mental stress, recovery draining resources that could otherwise be used to protect public health and safety. All of these kinds of effects make it extremely difficult to quantify the total health effect of any given tropical storm or hurricane. And so it's really difficult for me to tell you just what the effects have been of the recent hurricanes Helene and Milton. But from this recent research, we know that this could be something that the entirety of the American Southeast is going to face for the next 15 years or more. And we will continue to see health effects as this worsens in a changing climate. Next slide, please. Another effect of increasing temperatures, changes in rain patterns and disrupted ecosystems are a spread of vector-borne disease from insects, ticks, and rodents. These can all carry diseases that could be new diseases moving into new regions or worsening of existing diseases in areas that already have high prevalence of vector-borne illness. The people who are at higher risk here are people who spend more time outdoors, or if they need to spend more time outdoors. This can increase that cohabitation of the people with these vector-borne illnesses from the insects, ticks, and rodents. And so we see more of that transmission to humans. Next slide, please. Contaminated water is a major effect that can come from things like higher water temperatures, heavier downpours, rising sea levels, and more flooding from, for example, these extreme weather events. This can lead to gastrointestinal illness, diseases from toxins in swimming areas, and drinking water. This kind of groundwater contamination can also lead to significant bacterial outbreaks, causing significant health problems as a result. There are many groups who are at disproportionate risk as coming from this contaminated water. This is specifically children, older adults, people with weakened immune systems, people in remote or under-resourced communities with inadequate water systems, and people in communities that are dependent on fish or shellfish that may also be affected by this contaminated water. Next slide, please. And I'd also mention just a little bit of mental health problems, but due to any of these kinds of increases in environmental exposures due to climate change, we can have significant mental health problems that result from this. Increases in stress, depression, anxiety, PTSD, and even suicidal thoughts can result from any of the disruptions that are caused from these environmental hazards. There are, again, many people who are at disproportionately high risk. Populations like children and older adults, pregnant and postpartum women, people with existing mental health illnesses, people experiencing homelessness, first responders, and people who rely on the environment for their livelihood. All of this could be disrupted in a way that can significantly worsen mental health problems and stress over time as our climate continues to change. Next slide, please. Okay. Thank you. There are a variety of resources. Oh, you can go ahead to the next one, sorry. There are several resources that are available at CDC to support your climate and health activities. The resources I'll share here are mainly for your review after this presentation, so I'll just quickly introduce them for now. The first is our Heat and Health Tracker at CDC. This is a free, publicly available online tool to help emergency and public health planners prepare for and respond to extreme heat events. From this, you can find a variety of not just heat exposures, but the quantified health impacts from these heat exposures across the United States, as well as a variety of social vulnerability indices through tools like the Heat and Health Index that can help explain some of these other social determinants of health that could contribute to the negative health effects of this heat exposure across the United States. Slide, please. This is just an image showing what the Heat and Health Tracker looks like, but I urge everyone to click on that link after this presentation is done and explore this for yourself, because there are a variety of tools available to you through this webpage that can help address heat and health in the United States. Next slide, please. One of our newer tools is the Heat Risk Dashboard. This not only shows where it is hot in the United States, but where historically this heat has been a problem as it comes to public health. So it shows how hot it is across the United States, and when that heat crosses threshold that could become dangerous to human health for that population at that time of year. So this is one of our only at-a-glance tools that can really show when it is important to be activating certain public health initiatives, or discussing heat with patients or with communities you may be working with to make sure that they are protecting themselves and others from the risks of heat. Next slide, please. We've also recently released some materials for heat guidance for clinicians. This is a series of resources including information on patient management, heat and medication, and clinical guidance for working with patients with asthma, cardiovascular disease, and pregnant patients. Next slide, please. Among these guidance materials are recommendations for both clinicians and patients to better protect themselves and others from the health effects of heat and poor air quality, such as making a plan with your doctor. Next slide, please. You can visit our webpage shown here for all of our climate and health resources, including those external to CDC and those produced by some of our partners across the federal government. Next slide, please. And finally, we offer an online training in climate and health to better prepare you, partners, or staff to be better prepared to address the health effects of climate change. Next slide, please. All right, and with that, I'm going to pass it over to my colleague, Dr. Melissa Briggs-Hagen, to talk about some more emerging challenges.
Great, thank you, Dr. Mallon. Appreciated that presentation myself. So we're just going to start off, and we're going to switch gears a little bit and start off talking about this question. If you could answer, what is one thing you have found most useful when speaking to your patients about vaccines? and appreciate responses that are already starting to come in. Ease of access, facts, debunking, myths, basic information. I think we have about 169 people on the call, so hopefully we get a few more responses. Persistence, like that one. Benefits, great. Great. I'll just leave a couple more seconds. Trusted sources, absolutely expected outcomes. All right, appreciate that. Okay, so I think if we could move to the next slide, we just lost our slides. I am going to be giving a brief talk today on respiratory viruses, vaccine preventable diseases, and other emerging threats. And I'm thankful that you as frontline workers decided to come and participate in this session in general today. I hope it's a useful conversation and that we can give you some tools to bring back to your practices. Next slide. So I'm just going to start by talking a little bit about the fall and winter respiratory virus season, which we are currently entering. Next slide. So here is a quick snapshot of our current respiratory virus trends nationally. On the left is test positivity from labs for patients tested for COVID-19 in orange, for influenza in blue, and for RSV in purple. And on the right, we see the proportion of emergency department visits caused by each of these. At the end of September, you'll notice that we were just coming out of our late summer COVID-19 wave, and we were just barely starting to see some increases in influenza and RSV test positivity in this graph on the left, which hadn't yet spilled over to increased ED emergency department visits. However, if we look at the trend over the last couple of years, we can expect that cases will certainly be rising over the next few weeks, hence the desire to touch base with you all today. Next slide. So CDC has updated the way we share data on respiratory viruses with the public to try to make it easier to access both national and local data so that you can track how concerned you need to be about these respiratory viruses. This is just a snapshot of our respiratory illness data channel with the link for it at the bottom on the right. And here you can find overall and virus-specific activity, what it looks like nationally, and also you can select your county and see what's happening there. So I hope this is one tool that you'll be able to utilize. Next slide. I hope this slide is something you've already done, but ordering and offering immunizations in the clinics where you work is a really important tool for increasing immunizations and reducing disparities. Patients cite convenience as a major factor in whether or not they get vaccinated, and some of you spoke to that in your responses. And this page just highlights some tools we posted online this year to try to support clinics with ordering respiratory virus immunization products, including product summaries, links to ordering and reservation programs, return policies, and so on. So if you've taken advantage of any of these tools, would love to hear in the chat if you found them useful or if there's other things you think we could do to make this process even easier for you. Next slide. We've also created a number of tools to share the current guidelines about who should be vaccinated in simplified ways. For COVID-19 and influenza, the message is really simple. Everyone aged 6 months and above should receive both of these vaccines. For RSV, there are, of course, 2 different target populations. For infants, either the pregnant person should receive an RSV vaccine during their 32nd to 36th week of pregnancy, or the baby can receive nirsevimab, a monoclonal antibody to prevent severe illness during the respiratory virus season, or to prevent severe illness during the season. Lastly, for older adults, 75 and above, or 60 to 74 with risk factors, these adults should receive an RSV vaccine at least once. They do not need to get it again if they received it last year. All of these immunization products are currently available and in season now, so you can offer any and all of these to your eligible patients this week. Next slide. I won't spend much time on this slide, but this is just a graphic overview of the chronic conditions that make adults age 60 to 74 eligible for the RSV vaccine. Again, a tool to try to make it easier for you in your clinical practices. Next slide. And this slide highlights why immunizations remain so important. If you're like me, prior to COVID-19, you didn't spend a lot of time thinking about the number of hospitalizations or deaths caused by respiratory viruses in any given year. And given how much better things seem now relative to 3 to 4 years ago, it's really important for us to be able to remind our patients that respiratory viruses do continue to cause severe illness in thousands of adults each year, and that RSV is the #1 reason that infants in the US are hospitalized. While older adults and those with certain underlying conditions may be higher risk, we cannot always predict who will get severely ill from these viruses, but we do know that vaccines reduce that risk. They cut the risk in half for COVID-19 and flu vaccines, by about 70% for the RSV vaccines for older adults, and by over 90% for nirsevimab in infants. So these are powerful tools, and we just need to keep reiterating that. Next slide. In spite of all these benefits, vaccination rates against these viruses were quite low last year. And in our national survey data, many patients who are high risk even note that their healthcare provider never recommended vaccination. When healthcare providers were surveyed about the reasons that they don't offer vaccines, their main concerns that they highlight are concerns that the patients would refuse and vaccine fatigue as two of the most common reasons. Next slide. As a primary care provider myself, I certainly recognize these challenges. And again, just want to highlight that CDC does have multiple tools on vaccine confidence and talking with both patients and parents about vaccines that you may be able to tap into this season. This slide includes some sample language that demonstrates the recommended principles of being specific, being clear, being attentive, and feeling free to try again when talking to patients or parents about vaccines. I really like that somebody put persistence on the Mentimeter earlier. Next slide. And this study, published in the New England Journal, analyzed interventions to reduce disparities in COVID-19 vaccination and found that while most people who were willing to accept a vaccine did so after the first offer, some people who initially declined accepted after being offered 2 or even up to 11 times. Also of note, repeat offering helped to close gaps in that the uptake between Black patients, shown in orange here, and the overall patient group, shown in blue here, narrowed over the course of repeat offers. Next slide. Because we have many presentations today, I won't spend too long on this slide, but this is, again, just additional tools you can use to implement in your clinics to help increase vaccination coverage. Next slide. And I also want to highlight treatment with antivirals, which can further cut the risk of severe disease from COVID-19 and influenza. This is something that is available both for your patients who've been vaccinated and those who are not. Outpatient treatment does typically need to be started early during infection to be effective and should be given when symptoms are mild. So for patients that are eligible and may benefit from treatment, it may be worth talking to them now at their next visit, even before they're sick, about a plan as to how they could get tested and how they could access treatment if they were to come down with symptoms that were concerning potentially for COVID-19 or influenza this year. Next slide. Earlier this year, CDC released updated respiratory prevention guidance where we try to take a unified patient-centered approach rather than a virus-specific approach to managing symptoms and preventing spread. Now, rather than having a longer isolation period for COVID-19 as compared to other viruses, we recommend everyone who's ill stay at home until they have no fever without medications and symptoms are improving for at least 24 hours. And that everyone would consider additional precautions for the following 5 days with some of those additional precautions highlighted here, because we know that they still may be shedding virus during that time. Next slide. So these are some QR codes that can direct you to many of the resources I just mentioned. And I'm now going to move to touch on the other 2 topics very quickly. Next slide. So I'll briefly talk about broader challenges we're seeing with vaccination coverage nationally and the impact that it's having on the resurgence of vaccine preventable diseases. And some of this, I know you guys are from all over the country, so some of this you all may have already started to experience. Next slide. During the pandemic, routine vaccination among children declined and did not immediately recover, especially under some particular populations like rural populations and those who are living in poverty. Even though the decline seems small overall, for instance, here we see that there was a decline in coverage from 95% to 93% across multiple vaccines that were required for kindergarten. The impact of this is quite large. We estimate that with this decline, over 700,000 children entered kindergarten during the pandemic more susceptible to vaccine preventable diseases. Next slide. On top of that, you may have seen in the news that vaccine exemptions have steadily increased over the past few years. This is concerning nationally and regionally, as many states shown here in the darkest color have exemption rates over 5%. which means that these states are no longer able to achieve the 95% coverage required to prevent some vaccine preventable diseases from reemerging. Next slide. We've seen this, of course, with rising measles cases over the last year, and particular outbreaks and clusters in areas where there were large groups of under-vaccinated populations. And we've more recently seen resurgences in pertussis that you've maybe read about in the news as well. Next slide. Many of the tools that I mentioned before are relevant for routine vaccines as well. In addition, we've developed a number of targeted communications campaigns and materials that you can use in your clinics to help teach patients both about vaccine preventable diseases, many of which much of this generation has never seen, and as well as the vaccines, hopefully in a way that is empowering. The Keeps It That Way campaign on the left is focused on childhood vaccines. And the images, for instance, the one on the bottom right says, "She thinks measles are used for drawing in art class. Vaccines keep it that way." So kind of harnessing that when vaccines work, we don't see these diseases. The campaign on the right was designed to support maternal vaccination, especially among women of color who are often under-vaccinated compared to their peers. And it's really about the from me to you is kind of meant to be an empowering message that you are taking charge of passing on vaccines to your child or passing on immunization to your child. We welcome you to use these tools and to give us feedback on how they're being received in your clinics. Next slide. So for my last minute, I'll just touch very quickly on a couple of additional emerging threats. This will not be a very in-depth discussion, but we're happy to talk more about some of these during the Q&A period if that's helpful. Next slide. H5N1 is, of course, one that CDC is tracking closely, and given that Dr. Alcater will be speaking on this shortly, I won't say much about this particular agent, other than to note that we do have a number of tools online that provide additional information about what we know about this, how we're monitoring this, and how you can take precautions. Next slide. Another agent that we were asked to touch on was dengue, which is a viral disease transmitted by mosquitoes, and another one that the CDC has been closely monitoring. Thus far, there have been over 40 cases of locally acquired dengue reported in the US this past year. The majority of these have occurred in Florida, but as Dr. Mullen alluded to during his presentation, climate change can impact where these viruses are being spread, and it's likely that healthcare providers in the US will have to become more familiar with this disease as time goes on. Next slide. To that end, the CDC division that tracks dengue has released a number of resources lately, including issuing a health advisory over the summer and providing clinical modules on dengue testing, diagnosis, and care. And I've included some links to some of those materials here. In summary, healthcare continues to evolve. Sorry, next slide. In summary, healthcare continues to evolve, but thankfully we're living in a time when there are a lot of tools available to help our patients. I hope this presentation has been useful to you and look forward to hearing more about what we at CDC can do to support the work that you are doing during the discussion. I will now hand back over to Dr. Carrillo to introduce our last speaker.
Thank you so much for that information. I appreciate all of those helpful resources that will be shared here shortly. So now I'm going to briefly introduce our next speaker, Dr. Bethany Bogus-Alcatar, who is the Director of Research and Public Health Programs at the National Center for Farmworker Health. She directs a national program focused on reducing the burden of infectious disease among agricultural communities as a part of a cooperative agreement with the CDC. She holds a BS in Community Health, an MPH in Epidemiology, and a PhD in Occupational Epidemiology from the University of Texas Health Science Center. Her areas of expertise are focused on community-driven and participatory research, engaging agricultural and low-wage workers, and occupational health and safety issues for workers employed in agriculture and construction. Thank you so much for joining us today. I'll pass it over to Bethany.
Thank you, Gladys. All right, we can talk about bird flu now. Go ahead and go to the next slide. Thank you. So I'm going to provide a really quick overview of what's going on now and what's happening with bird flu nationally. And then I have to share some outreach safety guidelines that we'll briefly cover. And we have a resource that you can take with you if you need it for your staff and your coworkers. Next slide. So H5N1 is a specific strain of bird flu, and it was first identified back in 1996 in China. And in that year that it was found, it did cause 6 human deaths among people who were in close proximity to those infected birds. And then since then, what we've seen is that it's kind of expanded in different wild bird populations throughout Asia, throughout the Middle East and Europe. And we saw it spread. It didn't get over here to North America until 2021, where it showed up in Canada first, and then pretty quickly started showing up in the US and impacting our poultry flocks here. Go ahead. So even though it got identified in 1996, things have really been speeding up a bit in terms of what's been happening the last few years with H5N1. So obviously it's a bird flu. It's not that surprising to see it in birds, but what does get surprising is when we start to see it in mammals. So just from 2020 to 2023, we've seen it show up in about 48 different types of mammals in 26 different countries. Here in the US, in our poultry flocks, it's affected poultry flocks in 48 states, and it's quite lethal to poultry and birds, and we've had 100 million poultry affected by it just in the last 2 years. When mammals do get bird flu, usually what we see is carnivores getting infected. So a lot of times it'll be like a cat or a fox or something that's eating an infected bird, and that's how they get it. Next slide, please. But cattle, probably most of us have heard of this showing up in cattle. Cattle are a new host for H5N1. And it's a little strange since cattle are herbivores. It's not expected since it's very unlikely that they're eating infected birds. But somehow it got from wild birds into cattle. And now what's happening is that it is spreading cow to cow. And there's also some thought that possibly humans and machinery and vehicles are spreading it among cows as well and among different dairy herds. Currently, we have cows infected in 14 different states and about 300 different herds. It's okay, you can stay on the next slide. Thank you. So the only note on that was that cats often are the first sign, because cats get really sick when they get bird flu. There's a lot of cats on dairy farms and they drink the raw milk from the cows and get really sick and often die or get swollen eyes or things like that. So that's often the first sign we see. Now, H5N1 in humans, right now this year in the United States, there have been 20 confirmed cases of H5N1 in humans. There's 5 pending confirmation right now in California. All of these, all 24, are in farm workers, either poultry workers or dairy workers. There was 1 case identified, and someone who is not a farm worker had no known exposure to H5N1. They couldn't figure out how this person got exposed, and they're doing more work on that, the Missouri Department of Public Health. Right now, H5N1 is still considered a low risk to the general public, but it is a high risk for animal production workers and a few other groups. Next slide, please. So these are the groups that are at higher risk of exposure to H5N1 right now based on what we know. So that does include all the animal production workers, as well as, the producers, other folks on the farm, veterinarians and their staff who interact with livestock. Certain types of slaughterhouse workers are at risk if they do certain tasks. And then, of course, first responders, which can include people working in animal health and in public health. So if some of you work at a health center that does serve farm workers and does outreach to farms, then those CHWs or whoever is going to those farms could also be at risk. Go ahead. So we have created some outreach safety guidelines. This is something we've been hearing at the National Center for Farmworker Health. Folks who have been doing outreach to animal production workers really wanted some guidelines for their staff on how they could stay safe doing outreach on farms or in communities or at housing sites of animal production workers. Go ahead. In general, what we recommend is avoiding outreach right now on farms. This is partly because the testing of animals isn't great. It's not as extensive as we would like to see. And so it's quite possible that if you're doing outreach on farms, you could go to a farm and find out when you get there that there's a bunch of sick animals. So we recommend avoiding it. Obviously, we would strongly recommend avoiding outreach on farms where there are documented H5N1 infections, and it would be hard probably to get on those farms anyways. Before doing any outreach to animal production workers, all health center staff really should know how H5N1 is transmitted, how to prevent being exposed, and what the signs and symptoms are. And this is so similar, to what we saw with COVID. It's good practice anyways for any type of influenza to keep your staff from getting sick from any respiratory disease. Next slide, please. So in terms of how it's being transmitted right now to humans, we do know that there's a very high level of the virus in cow's milk. So avoiding any exposure to the raw unpasteurized milk would be what you want to do. If you've ever been inside a milking parlor, you know that's really challenging. And that's why there's a lot of PPE recommendations that are in these slides, but we won't go over. But really, you just want to prevent any exposure to your face or any open wounds to the cow's milk. For working with poultry, it's really the dust that's the bigger concern. So preventing exposure to breathing in dust from sick birds. There's also concern about contaminated surfaces and just being in a building or a general area with sick animals is a concern. We haven't seen here any human-to-human transmission of H5N1, but it has been documented in Asia in the past. So it would be best to be quite cautious if you're interacting with workers who have signs and symptoms. Next slide, please. This is a list of the signs and symptoms based on what we know now of H5N1 in humans, in cattle, and in poultry. So you can see in humans, most of it looks a lot like RSV or influenza signs and symptoms. So if you are doing farm outreach, it's good to look for signs and symptoms in animals as well, because that could indicate H5N1 potentially. But in humans, a lot of headache, fatigue, cough, sore throat, etc. And in dairy workers, we often see conjunctivitis because of milk splashing in the eye. Next slide, please. We have guidelines in here for doing on-farm outreach in case folks are needing to do that. Maybe you're supporting a health department, do seasonal flu vaccines to dairy workers or things like that. And so there are detailed guidelines in here, and basically the PPE guidelines for doing that type of outreach are the same for outreach workers as they are for dairy workers. But right now, I'm going to briefly go over just community and housing outreach, since that is most common in most places. Very efficient slide transition. Thank you. You can go to the next slide. So when we are talking about housing and community site outreach to animal production workers, we're assuming that you're not in contact with workers who have symptoms of H5N1. And PPE isn't necessary for this type of outreach, but your staff might choose to wear a surgical mask, or N95 respirator, which really isn't a bad idea given all the COVID and the flu going on right now anyways. Next slide, please. An important thing is keeping your open wounds covered and avoiding touching your mouth, nose, face, or your phone. And you can encourage all your coworkers to do the same. And then, of course, practicing good hand hygiene, which we all know well, either through work in healthcare or based on our experience in the pandemic. Next slide, please. We are encouraging folks to get the seasonal flu vaccine, especially if you are doing this type of outreach. It's not going to protect folks from getting infected with H5N1, but it will reduce their risk of having to fight multiple types of flu virus at the same time. Go ahead and go to the next slide. If staff are doing this type of outreach, they should also monitor themselves for any symptoms. And this is really important if they come in contact with a worker who has any of those symptoms. So we recommend keeping N95s in your car if you're doing outreach. And if you run into a worker who has these signs and symptoms, we would encourage the outreach worker and the animal production worker to both wear N95s. Gloves and goggles would also be prudent in this situation if possible. Next slide. Yeah, so this goes over in more detail what I just said about monitoring yourself for signs and symptoms after that situation has happened. Next slide. All right. These are a few resources we have. There's some CDC resources on here. There's some of our resources on bird flu for farm workers. And then these guidelines are summarized in a PDF, and that is linked in here as well. Thank you.
Thank you so much for that great information. And I just want to thank again all of our speakers today who we will be bringing on here in a minute. We're going to have our panel for any open questions. So if we can, Bethany, stay on here, and I'm asking our other panelists to also jump on. Dr. Millen, if you want to turn on your camera as well. Perfect. Okay, great. So we had already a couple questions in the chat, and Bob, feel free to come on here and join me if you'd like, so we can tag team this. I think there was a question about pregnancy and postpartum precautions, which Dr. Briggs-Hagen already addressed. But I did have a question, and we'll start with Bethany, since you just completed that information on H5N1. So if a health center wanted to incorporate some of these strategies within their outreach teams or into their patient education messaging, what is the best way to go about that, especially with individuals who maybe struggle to utilize some of these PPE equipment on farms? What is the best approach for them to take?
I'm so sorry. I got distracted by my kid's text message from school. Can you repeat that, Gladys?
No worries. What is the best approach for health centers or individuals who want to incorporate some of these tools, outreach strategies into their patient education messaging, especially if they're struggling to maybe use PPE appropriately?
So yeah, presuming if you're interacting with dairy and poultry workers, this is really challenging and might be hard to do like in a quick office visit, but this is where your CHW staff and your outreach staff, I think, can help a lot. That's what we're hearing, is a lot of dairy workers can't use the PPE or have a really hard time using the PPE. So we've been encouraging really good hand hygiene and then using PPE for when they can. In some places they can do it. And so it's kind of a matter of problem solving oftentimes with the workers, but certainly educating. People are also having a hard time understanding sort of the public health impact of this and the risk, because all the farm worker cases that we've seen so far have been very mild. And honestly, I think that's a pretty small percentage of the workers who've actually had it. And so we're seeing a lot of mild cases, and a lot of education is needed to understand that it is a serious disease and could get worse. And our odds increase of that every time someone gets infected.
Thank you, Bethany.
I had a question for for Dr. Evan Mallon. And just in general, Evan, in your presentation, you listed a whole bunch of great resources, the heat and health tracker and so on. And I'm just wondering, are there any associated initiatives where, you know, when you get to a point where in the season, you know, heat is such that it indicates there's going to be a problem, whether it's conjuring up a storm or just extreme heat, is there any work with the local communities or the states to then go out and take active, either something to combat, you know, the extreme heat, or for health professionals so they're ready to deal with the impact, including the folks at community health centers?
Absolutely. So the tool that I'm most excited about is our heat risk tool. That is our newest one. Like you mentioned, this is the one where not only does it say how hot it is, but is that heat expected to be a problem for the local population and at that time of year. We have heard from several health departments around the country that they are using this tool to activate various public health interventions. For example, things like cooling centers. So when they see that there is heat risk of a particular level of severity, then they will activate cooling centers. They will activate heat-related communications campaigns, things like this. These kinds of interventions can be really helpful in terms of having people protect themselves and others from the risks of heat. And so we are hearing that a lot of health departments are starting to use that tool. I would also highly recommend everyone here check out our clinical guidance, because that is, as part of our clinical guidance, we really hope that clinicians and community health workers will be able to use this in conjunction with tools like the heat risk map to be prepared to speak with communities, to speak with patients about the risks that they may face that are unique to them, such as what kinds of medications they may be taking that would worsen the health effects of heat. And so with all of that together, I think that our suite of tools can be really useful in terms of preparing everyone across the country for the rising threat of heat.
Great, thanks very much. And also had a question for Dr. Melissa Briggs-Hagen. And Melissa, you mentioned persistence, and you showed the very interesting table which showed the number of, you know, times you can basically ask or try or to convince somebody to take a vaccine. And I'm just wondering, is there any kind of optimal you know, number of times and any optimal approach that you guys have really seen good results?
Yeah, I actually think that a lot of your participants spoke to some of the key factors that we think impact whether or not somebody will take it. So, you know, they mentioned kind of highlighting the benefits, facts, you know, making sure, because there is so much misinformation. By and large, you as a healthcare provider are still a trusted messenger. And so you saying to them, this is beneficial, you know, I've done it, or I would do it for my family. This, you know, these are the risks. It does make a difference. I think because you all are working at the community level, you may also be able to tap into other community resources and other trusted messengers that, you know, we may not have direct access to here at the CDC level, but finding the people who can, you know, speak that your patients trust and reiterating those messages are important. I don't think there's an optimal number of times to ask. I mean, I don't know that I've gotten up to 11 in my own practice yet with anybody, but this is just to encourage you that just that somebody, you know, the fact that somebody declined at their last visit doesn't mean you shouldn't ask again or that they will always decline. So hopefully that is an encouragement for them.
Great. And a question for Dr. Bethany Alcartier, just relative to H5N1. I know it's a scary, you know, proposition, just if it did take off and really did have you know, human to human infection at some point. And I'm just wondering, you know, what is the I guess the chances of that? I mean, a lot of people, you know, you talk to H5N1 and people have been talking about it for years, and, you know, it's potentially the end of the world and all that kind of thing. And so just from your perspective, you know, realistically, what are we looking at? I mean, things have clearly gotten worse over the last few years, but what are the next few years hold for the health professionals, who are part of the webinar today?
I don't have that public health crystal ball to tell you the odds. I wish I did. I think the interesting thing that we're seeing with this is kind of where the fissures are in our public health system. And always, when we get to underserved populations who are served by many of these health centers is where we start to see some cracks, and there hasn't been enough trust building work with those workers who are in really remote areas, between producers, workers, the public health system, healthcare providers. There just hasn't been much work in that area. So now there's this desire to rapidly implement and rapidly scale up in a place where it hasn't seen much public health activity. And I think that's where we're seeing a lot of issues.
In addition to your guidance, are you guys offering training specifically in how to deal with H5N1?
Yeah, we have. We've had a cooperative agreement with the CDC on emerging infectious diseases impacting farm workers for the last 4 years. And this, we just started our 5th year, and a big focus of that is H5N1. So we're funding about 44 community-based organizations, some of which are health centers, to do H5, COVID, and flu outreach work to farm workers in their communities. And then we're providing a lot of trainings and learning collaboratives on those topics as well.
Right. And Gladys, do we have any other questions in the chat or in the Q&A?
No, I think that's it. Those are the ones I see there. Thanks again to all of our speakers today and for the great information and resources you provided. Again, for our audience, you will be receiving this information and the slide deck provided to you after today's presentation. So before we wrap up, we just want to go over a couple of resources provided by our own forum and TAPS. And you'll see those listed here. And again, they will be included in the packet provided to you of the slide deck in its totality after today's presentation. Next slide. Now, one pivotal thing that we do want to share is that if you are part of a health center, we encourage you to please provide input and complete the 2024 National Health Center Training and Technical Assistance Needs Assessment. This feedback really is critical, and it helps our training partners create learning opportunities designed specifically with your health center teams in mind. So you can go ahead and scan the QR code or the link that's provided in the slide deck so that you can provide that feedback to us and be able to formulate some really informational and resourceful trainings in the future. Next slide. So as we close, we again encourage you to please take a moment to complete the Zoom evaluation that will come up after you exit today's presentation. This always gives us feedback and input to be able to improve future activities. So we again welcome your input. Next slide. And thanks again for joining today's session. We encourage you to please participate in the 3 remaining webinars that are part of our series. You can register at the link provided in the chat. And with that, we will see you next time on December 18th, 2024, where we will address access and functional needs within your health centers. Thank you so much.
Here.